Dear students, we will continue with the synovial joints. In the previous class, we have learned about the features of a synovial joint. In the last class, we have discussed about the features of the synovial joint. So, what are those features you have observed? There will be the joint cavity, articulating surfaces, then covered by articular cartilage. Then there is the fibrous capsule, then the synovial membrane. Within the synovial membrane, the synovial fluid. The articular capsule is the fibrous capsule plus synovial membrane. In the classification of joints based on the structure and function, we have studied the fibrous joints which are immovable, cartilaginous joints which are slightly movable, synovial joints which are freely movable. So, we are going to study about this synovial joints which are also known as diarthrosis. They are further classified. So, what is that classification of synovial joints? The synovial joints are classified into two types depending on the axis of movement and shape of articular surface and depending on the number of articulating bones. So, depending on the number of bones and the movement and shape of the articulating surfaces of the bones. Depending on the number of articulating bones, it is divided into simple, complex and compound subtypes. Depending on the axis of movement, it is divided into plane, uniaxial, biaxial and polyaxial joints. Depending on the shape of the articulating surfaces, the uniaxial joint is further divided into hinge and pivot types. The biaxial joints are divided into ellipsoid and condylar types. The polyaxial joints are divided into saddle and ball and socket type of joints. Now let us see the classification of the synovial joints based on number of articulating bones. So, based on the number of bones that are articulating, it is divided into simple, compound and complex. Simple joint is one where only the two bones are there articulating, and in the case of compound joints, there will be more than two bones will be articulating. In the case of a complex joint, the joint cavity is divided by means of an articular disc. So, in a simple joint, only two bones will be articulating, and in the case of compound joint, more than two bones will be articulating. In the case of complex joint, there will be an articular disc dividing the joint cavity. Based on axis of movement and shape of articular surfaces, the synovial joints are classified into plane or flat type. See here, the articulating surfaces are flat, and this is the clavicle, and then this is the acromion. The example for plane is the acromioclavicular joint. Then they are further divided into uniaxial type of joints, and which is further subdivided into hinge type. Hinge means it will swing as it opens and closes like a door. So, this is a hinge joint between the humerus and elbow joint. So, like closing and opening of the door, the movements of this joint will be seen. So that's why it is hinge joint. Then the pivot joint. There will be a central pin on which the structures rotate. See, there is the central pin on which the structure is rotating. Example is the atlanto-axial joint which you are seeing. Then the biaxial joint. So here there is the ellipsoid type of joint which will be like a spheroid or like watermelon. It is ellipsoid type, and this is the one you are seeing between the metacarpal and phalanges. You are seeing it, the ellipsoid joint. Then there is the same ellipsoid, sometimes is called the condylar also. Then it is the rounded shape you are seeing. Condylar means rounded joint. Then there is the polyaxial joint, of which there is a saddle variety, and this is the saddle. Okay, like a saddle you will be seeing it. And then the carpometacarpal joint of the thumb is an example for saddle type of joint. Then there is the ball and socket joint. So there will be a ball, a rounded one, which is fitting into a depressed one. So the example is the joint between the femur and hip bone. That is the hip joint. And let us look into the details of the synovial joints based on number of articulating bones. We classify them into simple, compound and complex. So only two bones will be contributing for the articulation. That is the simple joint. What are the examples? The hip joint, the talotibial joint, ankle joint which you are seeing in this X-ray picture, then the interphalangeal joints. These are the examples for simple joint. And what is a compound joint? More than two articular bones are involved, sharing a common articular capsule. The example for compound joint is the radiocarpal joints. Then the complex joint. Joint is divided into two compartments by an articular disc or meniscus. So the example is the knee joint. You are seeing the image of the knee joint. Then the sternoclavicular joint is the other example for it. Let us review the synovial joints based on number of articulating bones. Here you are seeing only two bones articulating. This is a simple joint. Here how many bones you are seeing? 1, 2, 3. So this is a compound joint. See the image here. Two bones you are seeing them articulating, but the joint cavity is divided into two compartments, an upper compartment and a lower compartment by an articular disc. This is a complex joint. Hope now you have understood what is a simple joint, what is a compound joint and what is a complex joint. Now we will proceed with the classification of synovial joints based on axis of movement and shape of articulating surfaces. So the one is the plane joint. So in the case of plane joint, we have seen what is a plane joint. So there is no axis. Articulating surfaces are more or less plane or flat. They permit only gliding movement or translational movements in various directions. What are the examples for the plane joint? Acromioclavicular joint, intercarpal joints, intertarsal joints, joints between the articular processes of vertebra. You are seeing here in this picture. These are the superior articular facet and inferior articular facet. So the joint between these articular processes is an example for plane joint, and it is also called gliding joint. Then the next way is the uniaxial joint. In this, the axis of movement, so it moves in one axis. If it is moving in one axis, the degrees of freedom for the movement is 1 degree. So there are two subtypes in this uniaxial joint. One is the hinge type and other is the pivot type. So uniaxial joint means it moves in one axis and it has only 1 degree of freedom, and there are two subtypes in the uniaxial joint. One is the hinge joint, other is the pivot joint. In this picture, we are seeing the hinge joint, which is also known as gingivimus. So the movement will be along the transverse axis. One articular surface is convex and the other is reciprocally curved. One is convex, other is curved. Bones are united by strong ligaments. Example is what you are seeing here is the humero-ulnar joint or elbow joint. The other examples are the ankle joint and interphalangeal joints. The other variety of uniaxial joint is pivot or trochoid type. In this, the axis of movement will be along the vertical axis. One bone will be acting like a pivot and is surrounded by an osseous ligamentous ring. So, osseo-ligamentous ring will be surrounding this rod-like pivot. Examples for the pivot joint is atlanto-axial joint. This is the atlanto-axial joint, which is between the two vertebrae, cervical vertebra, the first and second. This is the atlas and axis. And in this, the pivot is the dense of the axis vertebra, which is fixed, and the ring is formed by the anterior arch of atlas and transverse ligament of atlas. So this is also the same picture. You are seeing the dense of the axis. This is the one, and this is the anterior arch of atlas you are seeing. Then the other one is the radio-ulnar joint, where the pivot is the head of radius that rotates within the ring formed by annular ligament of ulna, which is fixed. Then the other variety of biaxial joint is condylar joint. Actually, it is a modified hinge joint. Articular surfaces are known as the condyles. You know about the condyles of femur and condyles of tibia. So the pair of articular condyles will be enclosed in the same articular capsule or separate articular capsules. And this joint permits movement mainly in one axis. It is flexion and extension in transverse axis and partly rotation in the vertical axis. So that is the condylar joint. It's a modified hinge. Articular surfaces are called condyles. So the pair of articular condyles will be enclosed in the same articular capsule or separate ones. They permit movements in only one axis. That is flexion and extension in transverse axis and partly rotation in vertical axis. The examples for condylar joint is knee joint and temporomandibular joint. Now let us discuss about the polyaxial joints. In the polyaxial joints, movements occur in three axes. So there are 3 degrees of freedom of movement. What are the subtypes of the polyaxial joint? One is the saddle type, other is the ball and socket type. Let us see the saddle joint. The articular surfaces are reciprocally curved. See here. The movements are permitted in 2 axes with addition of some conjugate rotation around a third axis, which however cannot occur independently. The example for the saddle joint is the carpo-metacarpal joint of the thumb. Carpo-metacarpal joint of the thumb between the trapezium and first metacarpal. The other example is the sternoclavicular joint. The other variety of polyaxial joint is the ball and socket or spheroidal joint. The distal articular surface is the globular head, which fits into a cup-shaped socket formed by the proximal articular surface. This is the ball and socket variety of joint. Movements will occur around an indefinite number of axes which have one common center. So, ball and socket joint will have a ball-like globular head which will be fitting into a cup-shaped socket. Movements occur around an indefinite number of axes which have one common center. The examples for the ball and socket joint are between the head of femur and acetabulum. It is the hip joint which you are seeing. This is the hip joint. And then the other one is the shoulder joint. The other examples are the talocalcaneonavicular joint and the articulation between the incus and stapes of ear ossicles is also a ball and socket type of joint. Till now, we have learned the classification of joints into 3 broad types and subtypes in each type and the features of each of those subtypes. With examples we have learned. Now we will learn about the clinical importance of these joints.